Sorry to interrupt you, Sarah, sorry. Okay, so what we'll just do, we'll do questions at the end, if that's okay, because some of your questions that you might have might be answered in my presentation. So I'm going to be talking about the diagnosis, treatment and outbreak management as well of strangles. And I've got a little pointer here, which is, we'll come to that, what that is later. Right, well, Sarah's already shown some pictures where horses have got awful sort of abscesses that have burst out, and this is, this is as bad as it gets, really. I mean, this hasn't happened overnight. This has happened probably weeks and weeks and weeks ago, okay? Now, if we're going to diagnose it, there is a sort of an adage in equine medicine, and it's a little bit tongue-in-cheek. If it looks like strangles and smells like strangles, it is strangles. It doesn't mean that strangles smells. It just means that it looks, if it's classic, if you've got this business here, then you've definitely got a horse that's got an abscess that has burst out, and it's probably going to be strangles. But this is not when we want to diagnose. Well, we do want to diagnose it when it's, if we see this, but we want to diagnose the cases before they get to this point. Okay, so how do we do that? Well, one of the most useful ways is with the blood sample, and I'm sure a lot of you are familiar with the blood sample. And what this is, it's an ELISA, enzyme-linked immunosorbent assay. But there's also a lot of misinformation. People think that, well, I'll get a lot of false positives with this blood sample. But what does the blood sample actually test for? It's testing for exposure. It's not testing for the disease. Okay, so it's checking to see if the horse has been recently exposed to the bacteria Strep equi. So if you get a negative sample, okay, the antibody levels are low. Now, I say low, they're rarely zero. They can be, but they're rarely zero because it's an endemic disease. So lots of horses have been exposed to it in their lifetime. But if it's a low level of antibody, then it means that the horse has not been exposed in the last 2 weeks or within the last 6 months. Now, why do I say 2 weeks? That's because it takes 2 weeks for the antibodies to rise. So if you were to, if I were to get, heaven forbid, COVID-19 today, okay, my antibodies would not rise for another 2 weeks, 10 or 14 days. It would take that much time for my antibodies to rise to be detectable on a blood sample. Same thing for Strep equi and Strangles in Horses. It takes 2 weeks, at least 10 days, for the antibodies to rise to a level which suggests that that horse has been exposed. Okay? Bear that in mind. That 2 week time is always quite important, and I'll come back to that. So if your horse is negative, it either has never been exposed if it's very low, or hasn't been exposed in the last 2 weeks or less than 6 months. If it was exposed more than 6 months, the levels have gone up, but they have dropped back down again to a level which suggests that the horse has not been recently exposed, if that makes sense, okay? So if it's positive, if you've got a positive blood sample, what does that mean? Well, it just means that the horse has been exposed in the last 6 months. More than 2 weeks, but within the last 6 months, it has been exposed to Streptococcus equi, and it has mounted an immune response, which has been measured on the blood sample. So there are 3 scenarios as to why that horse has got high antibodies. Now, it's been recently exposed, okay, as I said, in the last 2 weeks. It's had the disease, and it has recovered, okay, so it's completely safe, but it has had the disease in the last 6 months, but it's cleared it completely. But the one that we want to, or most concerned about, is it's had the disease, and it's now one of the 10% of horses that has become a carrier, because these carriers can become completely outwardly normal, and can be outwardly normal for months, if not years. So they move around the world looking completely normal, go to different yards, go to different events, yet they've got the bacteria in their guttural pouches, and they can infect other horses when they go to these places. So it's the carrier animal that we're really most interested in. If we were magic, and if we could remove every carrier animal in the world, strangles would cease to exist. It needs a carrier animal. So the more carriers we identify, the less horses are going to be infected. Okay? So let's go back to the blood sample. We've taken the blood sample from your horse. It's positive. Well, we now need to determine, because it's shown that it's been exposed, we now need to determine, does this horse have the disease? So how do we do that? Well, the best way of doing that is with a guttural pouch lavage. So what we do is we put the scope in and we take a sample from within the guttural pouch. So I will stop and start this. Okay. Now, I don't know whether you could see that. It's a bit bright in here, I suppose. But this is the guttural pouch flap here. I might get the lights on for the video, actually. But this is the guttural pouch flap here. Now, you can't quite see it. But down here is the horse's larynx. Okay, so this is now, top is top, bottom is bottom. This is going into the horse's left guttural pouch, which is this whole thing here, and its airway is down here. Okay, so we keep watching the video. Oops, that's my mistake. Okay, we keep watching the video, and this is not, this is a video that I've taken from somebody else. We haven't got any of our videos. So we put a little probe into the guttural pouch, open the flap. It looks like a big fish's gill, looks like a gill. And we go in there, move around, and then we go, and inside the guttural pouch we are. Okay? Now that looks quite complicated in there, but it's not as complicated as it looks. And I'll go through it in a minute. So, we're all going to need to turn our heads to the right, because this is the top, and this is the bottom. Okay? So if I were to squirt something in here, it would run down this direction. Okay? You've got the hyoid bone here, which is part of where the larynx or the voice box is attached to. And we're going to see in a minute, as she looks around, okay, she's now moved it up and down. So top is top and bottom is bottom, okay? That's the carotid artery there, okay? The carotid artery, so we stay away from that, okay? That's not part of the testing procedure, okay? But basically what we're looking for here is we're looking for pus, okay? The horse looks pretty clear. Obviously things like these chondroids that Sarah mentioned and the pus are going to be at the bottom, but you can have bits of pus all over the place. So what this vet is going to do now is now going to squirt some sterile saline into the pouch, okay? It's going to wash down. There we go. This is the solution going in. It's washing down, and then she's going to move down where it's now sitting in the bowl and collect the sample. So we're sampling, if it's got a biofilm of Streptococcus equi, then we're going to pick it up in here, and we're going to do what's known as a PCR. We all know what PCRs are because we've gone through COVID, haven't we? So we all know what PCRs are. Looking for the DNA of Strep equi. Now, so regardless, if your horse has a positive blood sample, proving that it's been recently exposed, but we do this test, which is the test for the disease, and it comes back negative, it's negative. It's fine. Okay, regardless of what the blood sample says. So this is the best way of diagnosing strangles. But as you can see, it's quite invasive. It takes about £20,000 worth of endoscopic equipment, and unfortunately is reasonably expensive. So a guttural pouch lavage like this, and remember there's two of these, horses I've got two, so we do left and right, is about £300. Okay, so it's quite expensive as opposed to maybe sort of like, what, 80, 90 quid for the blood sample.
Does the horse have to be sedated?
And the horse had to be sedated as well, because it's up the nose and what have you. But this is the best way to diagnose strangles. Now the other way is with a nasopharyngeal swab. Now we've all probably had our lateral flows. This is a horse-sized lateral flow. Okay, we've used small, well, obviously we have smaller ones in there. Except me, I could fit this one. So what we need to do is put it right up the nose to the back of the throat. Ideally the horse swallows. It opens those guttural pouch flaps, okay? Hopefully if it's got any bacteria, we can maximize the chance of it coming out. We pull it out and then we do a PCR on this, okay? But if the horse is not showing signs, so hasn't got streaming nasal discharge, and a single nasopharyngeal swab is not very accurate. Now, I've always been told it's about 30% accurate, but I spoke to a pathologist and he said, if you're lucky, he said, really, it's about 10% accurate. So 90% of cases are going to be missed just by doing a nasopharyngeal swab. Different if they've got lots of discharge coming down the nose, fine. So we don't do this. If we're looking for carriers, we don't use these swabs. We do a guttural pouch lavage. Other ways we could diagnose it is we can swab an abscess. If you've got these discharging abscesses, the fresher the better. We can poke a swab into the hole and then try and do PCR on that. Yeah, reasonable, I suppose, but all sorts of bacteria are going to start growing in and around this wound site, and it may well exclude Strep equi, and we might even just not have Strep equi, even though it's in there, just not have it on the swab. So that's not ideal. And the last way, which really has no great advantage over the endoscope, but it is done in some parts of the world when they don't have endoscopes, is what we call a nasal wash, which is basically what we're doing is you're putting a catheter up the horse's nose, the horse is sedated, and it's literally a case of squirting saline in and then collecting it in a bag as it comes out and then looking for the disease. Again, because the bacteria reside mostly in the guttural pouches, if the bacteria are not in the nasal cavity at that time, then this is going to be falsely negative. So not ideal. Again, endoscope and a guttural pouch lavage is by far the best way of diagnosing it. Okay? So that's diagnosis. So how do we treat it? How do we treat strangles? Well, the first thing we need to do is get it away from other horses. Okay? It's a highly infectious disease, so we need to get this horse away from other horses, and isolation. Now, thankfully, strangles, or the bacteria that causes strangles, is not airborne, okay? But it can be spread some distance by the horse coughing and blowing its nose, okay? In air droplets and things like that, water droplets, I should say. So I don't know, without being gross, if I were to have a good cough, I could maybe get to these chairs, maybe. Okay, the guys at the back are going to be quite safe. So when we say isolation, we need, at least sort of maybe 10, 15 meters, maybe even more ideally. The more the better. But we're not talking in the next field. That's not going to be useful. I was at a call today, and I won't say where, and we were talking about a horse, had a bit of a swollen leg, and I said, well, it can go into a field this size. I said, it can go into this field. She said, that's the isolation field. And as we were talking, her horse went over and actually grazed the grass right next to the fence. So I said, well, let's come away from that because the horse is in isolation. So if you've got isolation, honour the isolation. Don't go near the isolation field with your horse, okay? But the main way that we treat strangles is we have to allow it to run its course, okay? We have to allow it to run its course. We can't give them antibiotics really, because no antibiotic will penetrate the abscesses that Streptococcus equi produces. Okay, all that really happens is that the abscess sits there, the antibiotics go around, stop it getting any bigger, they don't clear it, and then we stop the antibiotics and the abscess comes back again. So it can actually extend the duration of the illness by giving them antibiotics. Now we do give antibiotics if the horse is in a real dire strait, right? It can't breathe, the swellings are so bad that it can't breathe. We have to step in there and give it some supportive care, okay? We also sometimes give antibiotics if the horse spikes the temperature on that day. We can quickly give it antibiotics and we might get it treated before these abscesses start. But once you've got abscesses, antibiotics are no use. Okay? So we mentioned that horses can develop chondroids, and we can get them out, as Sarah already showed. Now, I wish it was as easy as that.
It's very unfair. It's really not like that at all.
I wish it was as easy as that. Obviously, it's not. I think it was last week, the week before, where I scoped a horse, and basically its guttural pouch was literally like a cup of custard. So it was just full of pus. Now, clearly there was no ability for me to grab that. Okay, it's like grabbing soup or grabbing a cup of tea with a fork. I couldn't pick it up at all. So we lavaged it. We just squirted in lots and lots and lots and lots of water at the top and just put its head down and just flushed it out as best we can. Now, we can't guarantee that we cleared it all. And we also can't see if there's an abscess at the bottom of that cup of pus that is producing all of this muck. Okay, if you've still got an abscess, no amount of flushing is going to help. We can put antibiotics into the guttural pouch to try and treat the biofilm, but it's really just an aid. It certainly isn't what we do to step in and that will cure all cases of strangles, okay? It's just to perhaps help a bit. But the main way that we treat it is we just let it run its course. Yes, if you've got awful things like this going on, this horse is going to be pretty uncomfortable. So we also give it some pain relief. We may well try and keep these clean, flush them out maybe, or if they've got swellings, we might put hot compress on them to try and develop this abscess. And in some cases, we might even lance, but we don't really lance because we don't want to cut through sort of healthy tissue and cause more problems. So we normally wait for it to burst by itself sometimes. But there's things that we can do. So really, treatment is pretty limited. It is a case of waiting for the horse to get over it, okay? If the horse doesn't get over it, there are some things we could do, but I'm not going to talk about those in this presentation. Maybe talk to you about them at the end. What I will say is, just by the by, if the horse has just got a guttural pouch, which is absolutely chock-a-block full of pus, I've had those before, where you literally go into the flap and it's like cheese, cottage cheese right there. You can't even go in any distance at all. What we can do surgically is we can actually cut a hole externally in the guttural pouch to try and get this stuff to come out. Okay? Right, so treatment is pretty limited really, unfortunately. So outbreak management. How do we deal with outbreaks? Got a little video to show you, but it's all about the traffic light system. Okay, and I'll go through what that means in a moment. So I don't have nice relaxing music. So we have three groups. The red group are those that have got it. Okay, they're the ones that have got the disease right now. The amber group are the ones that were in contact with those horses that have got the disease. Okay, so they're questionable. And the green group are horses that were nowhere near, have never been anywhere near the horses that have got it. Okay, you follow that? So those are the three groups that we create. But if one of these horses develops it or an in contact horse gets it, then they move up into the disease group, okay? And they need to stay here until all the horses have fully recovered. Okay? So let's just go through this a bit more. So these are the horses that have got it. These are the horses that are in contact with the red group, and these are the horses that have been nowhere near these two groups, all right? These are in a different part of the farm, had no contact at all. We're still going to monitor their temperatures, okay? We're still going to make sure that they don't show any signs, and if they do, if this horse here or this horse here develops a disease, gets a high temperature, they will move into the red group, okay? Now, this is all well and good, me saying this, but on some farms, this is impossible to do, yeah? It's what I try and implement. Say, right, we need three groups, red group, orange group, green group. And they say, well, hang on a minute, we don't do that. Or people say, well, I can't put my horse that has got the disease in with this horse because these horses don't get on. Or I don't want my horse to go in with that horse. Or I can't do that because it's the other side of the farm and it's too far for me to go. All these things happen. So it becomes quite difficult sometimes on farm to manage an outbreak. But in a perfect world, we're trying to set up these three groups, okay? And ideally, we would wait until these horses have recovered, declared these horses free of the disease by doing the guttural pouch lavage, and then we will blood sample all the horses, well, these ones at least, possibly these ones, but at least these ones after 2 weeks. And if these guys have got positive results on the blood, we will then scope them as well. Okay? Now, clearly, if these horses here that have got it have caught it from somewhere, so we often blood sample all the animals on the farm just in case there is a carrier that we don't know about. Okay? So we do a bit of investigation. And again, that's often a problem because they say, well, my horse hasn't got the disease, never been in contact, why am I spending £90 on a blood sample? But anyway. But as I say, prevention is far better than cure. Okay, and this is the crux of this presentation. We want to stop your horses getting strangles. Okay, that is vitally important. So any new horse that comes onto a farm, and in many cases here I'm preaching to the choir, which is great, is you will isolate the horse and you will blood sample it to see what its antibody levels are doing. Based on those antibody levels, we can then say, on the balance of probabilities, this horse now is safe. And some places, rightly so, have 2 blood samples. And why do they have 2 blood samples? Well, there's a chance that they were infected around the day that we blood sampled them first of all. So we leave them 2 weeks, just in case we've sampled them too soon, allow their antibodies to rise, and then blood sample them again. So if you've got 2 samples, 2 weeks apart, and they are low levels of antibody, then that horse is safe. Okay? But even when they're in isolation, as I say, we still take their rectal temperatures. And there is actually a website, which I'll talk about at the very, very end, which allows you to log your horse's temperature. And you can keep it logged. So I appreciate some horses don't like this, but if I'm perfectly honest with you, I can't really think of one that I haven't been able to take its temperature. Maybe one.
You couldn't take mine.
Could I not? and she's with us tonight. A big round of applause for the horse whose temperature we can't take. Thanks for coming along. So, but it is important that you are able to take your horse's temperature, because if it is isolated, you can take its temperature, because strangles will cause a rise in temperature. Okay? But thankfully, there is another way that we can help stop your horses getting the disease, and that is through vaccination. Okay, now we've had a few of these on the market, I appreciate that, but this one is different. Okay, I'm not just saying that, it is different. 22 years in development, which is longer than most or all the COVID vaccines that we were subjected to, which I happily took, by the way. Now it features DIVA. Now that's great, I do love little abbreviations, but it differentiates infected animals from vaccinated animals. This vaccine does not interfere with the blood sample. So if you have a vaccinated horse and you blood sample it, it will not increase its antibody levels that we are measuring on the blood in the blood sample. So it won't muck that up. We can still determine if that horse has got high antibodies or not. And if it's got high antibodies on the blood sample, it's still of interest to us. Doesn't interfere with the ELISA. So what are the benefits of vaccination? Well, pretty clear, really. For a start, it can obviously help your horse from getting the disease, but it also reduces the severity of the disease. Okay, reduces the number of the abscesses. Less abscesses is less contamination. Less abscesses is it's easier for the horse to recover. And a lot of horses will simply not develop the disease. And I'll go through the percentages in a minute. So if you've got a vaccinated horse, your horse is quite unlikely to get the disease. Okay? What's the regime? It's 2 vaccines a month apart. Okay, foals can be done from 5 months of age. We're used to that with our flu vaccines. Same with the flu vaccine, about a month apart. And then we would do another one, ideally at 3 months. And this really boosts the immunity up to a very high level. And then we can give them an extra booster or give them boosters thereafter 6 to 12 months based on the level of risk that we think is going on. Okay, so for example, if you've got a horse which doesn't really go very far, other horses on the yard sometimes go to competitions, things like that, but it doesn't really go anywhere really. It doesn't really join those other horses. Every 12 months will be fine. Okay, if you've got a horse that's a competition horse and is going away to different places, mixing with other horses, then we'd probably think about doing every 6 months. Or we might, if we really think you're going into an area that is a bit dicey, boost it every 3 months, okay, to really give it top-notch protection. So what have we got here? So the first vaccination, this is all a couple of weeks now. Remember, it takes 2 weeks for the antibodies to rise. After 2 weeks of the first vaccination, 30% protective. A couple of weeks after the second jag, almost 60% protective. But after the third vaccine, 94%. That's better than all our COVID vaccines. Okay, it's a pretty good vaccine. It is protective, okay? It is not a live vaccine. I don't know whether anybody here, no, I don't think anybody of your horses had that in the lip. You did? Yeah, years ago. So there used to be a live vaccine. That was a bacteria that was what we call attenuated, which means that its ability to create disease was removed, but it was still a live vaccine. And it was very difficult to use, and we had to dilute it and stick it into the lip, and it wasn't particularly pleasant. This is not a live vaccine. Okay, this is a modern vaccine that does not have any live bacteria in it whatsoever. Okay, so there is absolutely no chance your horse can get strangles after this has been given to it. No chance at all. Okay, in the same way that there was no chance of us getting COVID from our vaccines. Okay, that's not an RNA vaccine, but it is basically a very modern vaccine. Okay, so just to summarise, and we'll answer some questions. I've got some other resources to show you as well. Any new horse that comes onto the yard, you must isolate it for at least 2 weeks. Ideally 3, but 2 weeks minimum. And get a blood sample, or if you can, 2 blood samples. Ideally 1 before it even arrives. And monitor the horse's temperature. Preventing this disease is far easier than treating it. Trust me, it is so much easier to prevent it than treat it. Okay? Now, if you do have a sick horse that spikes a high temperature, don't see what it's like in a few days. If it's got a discharge, don't just give it a wipe and think, oh, it's fine. Give your vet a call and get your vet to examine it. Now, we are going to need to do some tests, and I know those tests cost money, but I think we all owe it to ourselves to be vigilant about this disease, and if we do think we've got a sick horse, is to do the work diligently and see if it's got strangles, okay? Get your horses vaccinated now. That's not something that I could say a few months ago, but I can now say get your horses vaccinated because they're highly unlikely to get the disease after they've had the 3 vaccines, okay? And finally, don't panic, it's fine. Strangles produces such hysteria. It's fine, it is a disease and horses get it. It's the way we keep horses in this country, is we have stables, we have livery yards, horses come and go, okay? We are gonna see strangles, unfortunately, unless we can deal with this, get your horses vaccinated, deal with all the carriers. But at the moment, as Sarah said, there are a lot of cases in the UK every single year. So some resources that I want you to make a note of, and I can put these on our Facebook page as well, this is the strangle surveillance that Sarah spoke about, okay? It's not a particularly jiggy web URL there, but it is a URL which you could write down. You can go and visit this website, and it's basically some resources there that are quite useful. You can log if your horse has had strangles, and all that data goes to log in what's going on, and try and work out where the cases are occurring. Okay. Red Wings also have got a great resource as well. They've got a Strangles hub, and this is where you can also log your horse's temperature as well. They've got an event rider. I don't know her surname actually. Piggy, what's her surname? Thank you. Yeah, she's. Yeah. Okay. I thought she was Piggy French, but she's changed. Actually. That's why I couldn't remember. So, and she's on there talking about how important it is to take your horse's temperature. Okay, so that's a great resource as well.
There's also some information about those things in the packs as well.
Oh yeah.
Like for reference.
Great. Thank you, Gemma. And finally, there is the strategy to eradicate and prevent strangles, known as STEPS, which is the Scottish Rural College provide this. And it's basically just ways, if you do go away, what do you do when you go away? Do you just take your own buckets, keep your horses away from other horses, don't touch other horses, don't let people touch your horse, etc., etc., etc. But there's also some good ideas as to how to prevent strangles when you go away onto competitions. So that's it. Any questions?